Welcome back to the deep dive. Today we are taking a scalpel to one of the most central, most complex, and yet I think fundamentally misunderstood systems in American financial life.
Well, we're talking about U.S. Social Security.
Exactly. Officially, you probably know it as Old Age, Survivors, and Disability Insurance, or OASDI.
And it's a system that touches nearly every American worker, but you're right, very few of us really understand the wiring under the hood.
It's so much more than just a check in the mail. It's really the cornerstone of retirement security for millions.
It is. And for anyone trying to, navigate their own future or just wanting to be well informed on a huge national issue, getting a rapid, comprehensive understanding is vital.
So our mission today is to cut through all the noise, the political talking points, and just dissect the actual history, the structure, the funding, all of it.
Using only the extensive source material you provided, we're going to get into the real mechanics and, of course, the future challenges.
And before we dive into any of that, we have to establish the scale here, the sheer immense scale. This is not some small government program.
No, it's an economic pillar, just a staggering proportion.
I mean, the cost alone. Let's start there.
The cost is, it's astronomical. In 2022 alone, the total cost hit $1.244 trillion.
Trillion. And that's just over 5%. I think it's about 5.2% of the entire U.S. gross domestic product.
It's massive.
And to make that feel a bit more real, on an individual level, the average monthly benefit that was paid out in May 2025 was $1,903.
And that $1,900 is what keeps huge segments of the population, retirees, the disabled, surviving families, financially anchored.
It's the floor for millions of people.
And what's really remarkable is the program's reach. I mean, the sources show that nearly 94% of all individuals in paid employment in the U.S. are covered by Social Security.
94%. That level of universality is just, it's so rare in federal programs.
It really is.
But that number, 94%, it immediately raises a question for me. Who are the other 6%? Who's not covered?
That's a crucial detail, and it's a big group. It's approximately 6.6 million state and local government workers.
So like teachers, firefighters?
Exactly. That accounts for about 28% of all state and local employees. Because of historical exemptions that go way back to the program's beginning, they have their own separate pension plans.
So they're not paying FICA tax.
Right. They're relying on their own state or city pension systems instead. It's a huge segment of the workforce that functions completely outside the core system we're about to deep dive into.
Okay, so let's unpack this. To really get the system as it operates today, we have to go back, way back.
To 1935. The Social Security Act was signed into law by President Franklin D. Roosevelt right in the depths of the Great Depression.
And it was revolutionary.
Completely. The sources define its original purpose as implementing social insurance. This is a brand new concept for the U.S. government.
Social insurance meaning what exactly?
A federal mechanism designed to limit these, unforeseen dangers in a modern economy, specifically old age, disability, poverty, and unemployment, things people couldn't prepare for on their own.
You'd think, given the state of the country then, it would be an easy sell. But the political friction around it was just intense.
Oh, yeah. It was immediately and very aggressively labeled by opponents as socialism.
Of course.
And that opposition is key to understanding why the system was set up the way it was. It had to be framed as insurance, something you earn through your contributions, not as, welfare.
The anxiety was that real.
It was palpable. And I love the specific anecdote from the Senate Finance Committee hearing that just captures this tension perfectly.
Tell us about that.
So the Secretary of Labor, Francis Perkins, was testifying. And Senator Thomas Gore, a Democrat from Oklahoma, by the way, he interrupted her. He was really skeptical.
And he asked her directly,
point blank, "Isn't this socialism?" And Perkins says, "Oh, no." But Gore, he's smiling, and he leans in and presses her. "Isn't this a teeny-weeny bit of socialism?"
A teeny-weeny bit. That's fantastic.
It just illustrates the massive political leap this program represented at the time.
A teeny-weeny bit of socialism that pretty quickly grew into a giant of a program. Once it was established, it didn't just sit there. It evolved through decades of amendments.
Constantly expanding its scope. We should probably track some of the key milestones that really define the system we know today.
Let's do it.
Okay, so just 4 years after it was signed, in 1939, the program expanded its definition of who gets benefits. It wasn't just for the worker anymore.
They added benefits for the spouse and minor children.
Exactly. And that one change shifted Social Security from being a purely individual retirement program to more of a family protection system, a safety net for the whole family.
And then the program officially gets going with the very first monthly benefit check in 1940.
It went to Ida Mae Fuller for the amount of $22.54.
$22.54. It is just a fascinating historical marker that this colossal system started with a check that small.
The expansion kept rolling post-World War II. The disability program was added in 1954.
Formalizing protection for workers who got sick or injured and couldn't work anymore before retirement age.
Right. But the single biggest expansion, the one that probably changed the entire trajectory of the SSA forever, came in 1965.
That was Medicare.
Medicare, adding healthcare benefits to the Social Security program.
And that was explosive.
Absolutely. The sources note that 20 million people joined the program in just the next 3 years. It just underscores the immediate, desperate need there was for that kind of federal health coverage.
Okay, moving into the 70s, we see a change that affected every single retiree from then on.
The automatic cost of living adjustments. The KOA
Were started in 1975.
And that was huge for stability. Before 75, Congress had to actually vote on COA adjustments. They were irregular. Sometimes you saw these massive jumps, like a 77% COA in 1950.
That creates so much volatility.
So much. The automatic COA linked to inflation made future benefits predictable. It protected their purchasing power.
And then we get to 1983. This was maybe the most pivotal year for modern Social Security, and it was driven by solvency concerns even back then.
Oh, the changes that year were seismic. First, they started taxing Social Security benefits for higher income beneficiaries.
That was new.
Completely new. Second, new federal hires had to join Social Security. And critically, they increased the normal retirement age for younger workers, setting it on that gradual path towards 66 and then 67.
Those adjustments really changed the math for future generations.
Fundamentally altered the balance of what you pay in and what you get out.
It's also really important that we clarify the umbrella term Social Security Act, because it's more than just retirement checks. The Social Security Administration, the SSA, it mainly runs two enormous programs.
Right. The first and the core focus of this deep dive is OASDI old age, survivors, and disability insurance. This is that pay-as-you-go social insurance system we've been talking about, funded by FICA.
And the second major program run by the SSA is Supplemental Security Income, SSI.
And SSI is different. It's a separate, means-tested federal public assistance program. It's designed to give extra income support to aged, blind, and disabled people who meet these really strict income and resource tests.
So that's more of a welfare program.
It is. And it highlights how the SSA acts as this dual agency. It manages both social insurance with OASDI and welfare assistance with SSI.
And there's overlap.
A lot. In 2022, 2.5 million Social Security beneficiaries also needed that supplemental income through SSI, which really just shows you the poverty line so many retirees are struggling to stay above.
To really grasp the system's current reach, let's look at who's getting the benefits today. The 2023 data says the total number of people getting a Social Security check was about 66.8 million.
66.8 million. That's a population roughly the size of France, all getting a monthly payment. And the sources break this huge group down into three main categories.
This is the largest group. The one everyone thinks of is the retired workers and their families.
Right. That group totals 52.4 million people.
Hey.
And that includes the main worker, but also spouses and minor children who are collecting what are called derivative benefits.
Then you have the disability recipients. That's the DI part of OASDI.
In 2023, that was 7.4 million disabled workers getting checks, plus another 1.2 million dependents, so their children and spouses, who rely on that disabled worker's earnings history.
And finally, the survivor group, the S in OASDI.
About 5.8 million people were getting some type of survivor benefit, and this includes about 2 million kids who lost a parent.
Which really emphasizes the program's crucial role as like a life insurance policy for young families, not just retirement income for the elderly.
It's a huge part of the program that often gets overlooked.
Okay, so that is an enormous financial obligation. We're talking over $1 trillion a year. So how is this behemoth funded?
It's financed primarily through mandatory payroll taxes, the infamous FICA and SECA taxes.
FICA is the Federal Insurance Contributions Act, which is for employees.
And SECA is the Self-Employed Contributions Act. The key mechanism is the total payroll tax rate of 12.4% of your earnings, but, and this is a big, but only up to a taxable maximum.
And that 12.4% is split down the middle between the worker and the employer, right?
That's correct, for standard employment. You, the employee, pay 6.2%, and your employer matches it with another 6.2%.
But if you're self-employed, you're on the hook for the whole thing.
If you're self-employed under FICA, you're responsible for the full 12.4%. Though you can deduct half of that amount, what would have been the employer's share on your federal income tax return.
Okay, so this brings us to the first major controversy in how the system is designed, that taxable maximum. The model projects that for 2026, the maximum amount of taxable earnings for OASDI will be $184,500.
And that number is so crucial because any wages you earn above that ceiling are completely untaxed for Social Security purposes.
That is the literal definition of a regressive tax structure.
It is. As a high earner's income goes up above that cap, the percentage of their total income that goes to Social Security taxes actually goes down.
And we have to emphasize a key distinction here because the Medicare tax is also part of that payroll tax, but it works differently.
Very differently, the separate Medicare tax for hospital insurance, which is 2.9% total, split 1.45% from you, 1.45% from your employer, that has no taxable income ceiling at all.
So all your earned income is subject to the Medicare tax.
Every penny. But the Social Security tax base is capped, and that cap is the main thing driving the whole solvency debate we're about to get into.
So where does all this FICA money actually go? It doesn't just sit in a vault somewhere.
No, it's immediately routed into the Social Security trust funds.
Funds, plural.
Right. There are two legally separate funds for the two main benefit types, the Old Age and Survivors Insurance, or OASI Trust Fund, which gets 10.6% of the payroll tax.
And the other is for disability.
The Disability Insurance, or DI Trust Fund, which gets the remaining 1.8%.
Okay, so we often hear critics say that the government spent all the Social Security money, especially when the system was running a surplus from like 1983 to 2009. Is that accurate? Is it an oversimplification?
It is an oversimplification, but it gets at a very real tension in the accounting. When revenues were higher than spending, the law requires that surplus to be invested entirely in special series, non-marketable U.S. government bonds.
So the funds didn't just disappear.
No, they were legally converted into IOUs from the Treasury.
So in effect, the trust fund, by holding these government bonds, was indirectly financing the federal government's general deficit spending.
Correct. The money was used for other government operations. The government essentially takes an internal loan from the Social Security Trust Fund.
And those reserves are huge.
As of 2022, they were $2.818 trillion. That's $2.7 trillion in the OASI fund and $118 billion in the DI fund. That reserve represents the government's promise to pay back the principal and interest on those bonds when the SSA needs the cash to pay beneficiaries.
That massive reserve sounds like a great safety cushion, but the inescapable issue is demographics.
The baby boomers.
The baby boom generation is retiring en masse, and that's shifting the ratio of workers paying in to beneficiaries taking out. And this brings us to the solvency question.
The demographics are the elephant in the room. According to the 2024 Trustees Report, the combined OASDI Trust Fund reserves, all those bonds, are projected to be completely depleted in 2035.
And that is the headline everyone focuses on.
It is.
But this is where the public misunderstanding is greatest. When those bonds are depleted in 2035, does Social Security just stop? Does it cease to exist?
No, absolutely not. And this is probably the most critical takeaway from this section. If the bonds are all cashed out in 2035, the system doesn't disappear.
Why not?
Because the incoming payroll tax revenue from all the people who are still working would still be sufficient to pay approximately 77% of all the scheduled benefits.
So the system is still getting a massive fire hose of money coming in every day.
A huge amount. It just can't meet 100% of its promises without some kind of legislative change.
So the core crisis isn't total collapse. It's the political dilemma of facing an immediate, across-the-board 23% benefit cut unless Congress does something.
Exactly. The problem is a shortfall, not total bankruptcy.
Right.
And the sources quantify this gap. The estimated 75-year actuarial deficit is 3.61% of payroll.
Which means what, in plain English?
It's the theoretical increase in the payroll tax rate you'd need right now to maintain solvency for the full 75 years.
And if we look at the total scale of the problem, the sources set this unfunded obligation at what, $15.1 trillion in present value dollars?
That's based on 2009 data, but yes, that number represents the gap between all the projected future costs and all the expected contributions. That $15 trillion number is what really drives the constant political debate.
When a number is that large, it guarantees that Congress has to be constantly looking for solutions. So let's look impartially at the three main categories of fixes that are discussed in the sources.
First up is the tax side-finding ways to bring more revenue in. The most popular solution, at least among some Democrats, is lifting that payroll ceiling.
Right, getting rid of the cap.
Former Secretary of Labor Robert Reich is a big advocate for this. He suggests lifting or even just eliminating the payroll ceiling, which is $168,600 in 2024. If you do that, high earners would pay FICA taxes on all their wages.
Which would boost revenue significantly and, at the same time, fix the regressive nature of the tax.
Exactly. The other simpler revenue option is just to increase the overall FICA tax rate for everybody.
A straight-up tax hike.
Right. The sources show the direct math. If workers and employers each paid 8.8% instead of the 6.2% they pay now for a combined rate of 16.0%, that increase alone could provide solvency all the way through 2090.
75 years of full benefits.
But it requires everyone to take a 1.8% cut in pay.
Okay, so moving to the benefits side, what are the ways to reduce future payouts? Raising the normal retirement age seems to be the classic lever to pull.
It is, because it just pushes the cost out. One proposal that's cited suggests gradually increasing the normal retirement age by 2 months per year until it hits age 69 in 2034.
And that would significantly reduce the lifetime payouts for future retirees.
And dramatically improve the system's solvency.
Then you have the most politically volatile proposal, means testing.
Means testing. This involves phasing out or reducing Social Security benefits for people who have high income from all sources during their retirement.
So not just from work.
Right. And the source material notes that if benefits were phased out for people earning, say, over $48,000 a year, it would eliminate over 20% of the current funding gap.
But that proposal really challenges the core idea of the system as insurance, the idea that you earned this benefit by paying FICA taxes your whole life.
Exactly. And the unpopularity reflects that. Only 31% of households surveyed were in favor of means testing. It turns Social Security from an earned insurance into a welfare program in the eyes of a lot of people.
There are also less drastic benefit reductions proposed just for new retirees.
Yes. Proposals for like a 3% to 5% reduction in benefits just for new retirees. The source material suggests this smaller, across-the-board cut could eliminate between 18 and 30% of the funding gap.
And these cuts tend to be favored by people who want to avoid tax hikes but also want to keep the system universal.
Right. And finally, there's a really technical adjustment related to the calculation itself, averaging in more working years.
How does that work?
Right now, your benefit calculation uses your highest 35 years of earnings. If you increase that averaging period to, say, 38 or 40 years, it would mean that for most people, more years of low earnings, or even zero earning years, would get included in the average.
Which would naturally lower the average.
It would lower the average index monthly earnings, or AIM, and that could reduce the overall deficit by 10 to 20%. But it disproportionately impacts workers who had interrupted careers, like caregivers.
That discussion of the average indexed monthly earnings takes us neatly into the math behind an individual's benefit check. This is where the system's design really shows its goals.
Okay, first, eligibility. To be fully insured and eligible for retirement benefits, a worker needs 40 quarters of coverage, or QCs.
Which is usually about 10 years of work, right, since you can earn up to 4 QCs a year.
Exactly. Once you're eligible, the SSA needs to determine your primary input number, the AIM.
AIM. What does that stand for again, and why is that the key number?
AIME is the average indexed monthly earnings. It's the key because it represents your career-long average wage, but adjusted for inflation.
How do they do that?
It's calculated using your highest 35 years of earnings, which are first adjusted, or indexed, to reflect the average national wage growth over time. This makes sure that the salary you earned back in 1995 has the same relative purchasing power as the salary earned today.
And if someone has a shorter career, say they only work for 30 years.
Then those 5 non-working years are assigned a big fat zero in the calculation. Yeah. The SSA sums up the highest 35 years of these indexed earnings and divides that total by 420, which is 35 years times 12 months, to get to the AIM. And that AIM is then used to determine your base benefited amount.
That base benefit amount is called the primary insurance amount, or PIA. And the way the PIA is calculated is really the heart of Social Security's progressive design.
The PIA formula is brilliant. It's brilliant in its simplicity and its equity goal. It uses what are called bend points that are updated every year based on wage growth.
Let's use an example. For a worker who turns 62 in 2024.
Okay, this is where those famous percentages come in. The formula works in 3 brackets based on your AIM. First, you get 90% of your aim up to the first bend point, which was $11,074.
90%, that's a huge replacement.
Huge. Second, you get 32% of the aim between $1,174 and the second bend point, which was $7,078.
Yeah.
And third, you get only 15% of the aim over $7,078.
So it goes from 90% down to 32, then all the way down to 15%. That is an enormous drop-off in the replacement rate as your income goes up.
It's designed to be highly front-loaded. A worker whose average earnings were low, so they fall below that first level of 174, the threshold, they get a benefit equal to 90% of their average monthly indexed earnings.
That's a near total replacement of their working income.
It is. But a high earner only gets 15 cents back on the dollar for their earnings above that second bend point. This is the mechanism that takes that regressive tax we talked about and makes sure the benefit payout is highly progressive. It provides a much stronger safety net for those who need it most.
And the CBO data we mentioned earlier, that backs this up.
Completely. The benefit-to-tax ratio for the lowest earners is nearly triple that of the highest earners, all because of these bend points. It's an intentional, mandated redistribution inside the system.
So once that PIA is calculated, that's your full base benefit. How is that protected over time?
A worker who claims their benefits at exactly their full retirement age, or FRA, they get 100% of their calculated PIA. Then, year after year, that monthly benefit amount is indexed for price inflation using the COLA.
So it keeps its purchasing power for your entire retirement.
No matter how long you live.
Understanding the PIA is one thing, but maximizing it means you have to navigate all these complex rules around timing. Let's start with the full retirement age, the FRA.
The FRA, or the normal retirement age, it's changed over time. For a long time, it was 65. But the 1983 amendments gradually increased it to help with solvency.
So for anyone born in 1960 or later, the FRA is now 67.
Right. And the earliest you can claim, which is age 62, has stayed the same. But the penalty for claiming early has gotten much steeper as that FRA has moved up.
And this brings us to the biggest personal financial dilemma for most workers, the claiming decision. Claim early versus delaying.
Right. If you claim early at age 62, you get a permanently reduced benefit. And because that window between 62 and 67 is now 5 years long, the reduction is substantial.
How substantial?
For someone with an FRA of 67, claiming at 62 results in a benefit that is only 70% of their PIA. Think about that. That's a 30% lifetime reduction compared to just waiting until 67.
On the other hand, the system highly incentivizes you to delay your retirement past your FRA, at least until you're 70.
Oh, yeah. If you delay claiming up to age 70, you earn what are called delayed retirement credits, or DRCs. For anyone born in 1943 or later, these credits increase your monthly benefit by 8% for every year you delay.
8% a year.
Or 2/3 of 1% per month.
So if my FRA is 67 and I wait until I'm 70, what does that get me?
Your benefit jumps to 124% of your calculated PIA. And that 24% increase is logged in for life, and it also gets all the future CLAs.
That's arguably the best risk-adjusted return you can get anywhere for your retirement savings.
It is, but it's critical to note that the benefit increases stop completely after age 70. There's no added financial incentive to wait past that point.
The decision gets even more complicated if you decide to keep working while you're collecting benefits, but before you hit that FRA mark.
The earnings test. This is a complex rule that surprises a lot of people. If you're working and you are under your FRA for the entire year, the SSA will deduct $1 in benefits for every $2 you earn above an annual limit.
So if you earn too much, they claw back some of your benefit.
Exactly. The sources reference the 2013 limit of $15,120.
But that calculation changes a lot in the year you finally reach your FRA.
Yes, in that specific year, the deduction softens quite a bit. It becomes only $1 for every $3 you earn above a much higher limit, which was $40,080 back in 2013.
And the most critical point is what happens once you hit your actual full retirement age.
The earnings test stops completely. You keep all your benefits no matter how high your current earnings are.
Beyond the primary worker, the system covers family members, spouses, survivors. Let's talk about the complexity of dual entitlement.
Okay, so a spouse, or even a divorced spouse, can get a derivative benefit if they're 62 or older. The maximum they can get is 50% of the worker's PIA.
But the dual entitlement rules are there to prevent, double dipping.
Exactly. The beneficiary gets the higher of their own earned retirement benefit, or the spouse benefit. You can't stack two full benefits on top of each other.
And the source material highlights that these rules disproportionately affect women. Why is that?
It's largely due to historical wage gaps and career patterns. Many women have career earnings that are lower than their current or former husbands, so their own retirement benefit is often lower than the 50% spouse benefit they qualify for,
So the system pays the higher of the two.
meaning they may get zero benefit based on their own work history and rely entirely on their spouse's record. In 2022, 7 million women were navigating these dual entitlement rules.
Survivor benefits for widows and widowers, they work differently and are critically important, especially when it comes to those delayed retirement credits.
Yes, a widow or widower is eligible for 100% of their deceased spouse's PIA if they claim at their own FRA. And here's the key financial implication for survivors.
The DRCs.
Any delayed retirement credits the worker earned by putting off their retirement, those are carried forward, and they increase the survivor's benefit as well.
So the decision to delay claiming isn't just an individual choice.
It's a family safety decision.
Now we have to talk about the offsets, which often blindside people who had jobs not covered by Social Security. First, the windfall elimination provision, or WEP.
The WEP is designed to prevent a specific kind of windfall. Remember those 903215 bend points? They're progressive.
Right.
Well, without WEP, someone who worked only a few years under Social Security but has a generous separate pension, say, from a state government, would look like a low-income worker to the SSA. They'd qualify for that massive 90% replacement rate, even though they're actually pretty well off because of their other pension.
So WEP steps in to adjust that 90% factor down.
Down to between 40 and 85%, preventing that unearned windfall and aligning their replacement rate more closely with what a career Social Security worker would get.
And it's triggered for workers with fewer than 30 years of substantial Social Security earnings and a pension from non-FICA covered work.
Exactly. It's an equity measure to close that loophole.
The second major provision is the government pension offset, or GPO.
The GPO targeted the spousal and widow benefits. If a person received a non-FICA covered government pension in their own right, the GPO would reduce or even eliminate any spousal or survivor benefit they were entitled to.
How much was the reduction?
The rule was that the Social Security benefit was reduced by 2/3 of the amount of the government pension. The intent was similar to WEP, preventing double-dipping on derivative benefits when the person already had a substantial non-covered public pension.
So if your non-covered pension was high enough, your Social Security spousal benefit could be wiped out completely.
It could. However, we have a very important update here that's noted in the source material. The GPO was repealed by the Social Security Fairness Act of 2023, which was signed into law on January 5, 2025.
So that's gone.
That removes a massive complexity for future beneficiaries who have government pensions.
Okay, let's shift our focus to the administrative reality of running this massive system. When someone applies for benefits, especially disability insurance, and gets denied, they face this staggering internal appeals process.
That whole process is managed by the Office of Hearings Operations, or OHO. It's gone through a bunch of names, like OBAR or OHO. This agency runs the Administrative Law Judge, or ALJ, hearings.
They're essentially court appearances for people who were denied benefits.
It is, in fact, the largest system of administrative courts in the entire United States.
And the appeals path itself is exhaustive. It can take years.
It's an initial denial, then a process of reconsideration, then the actual ALJ hearing. If you're still denied, you could appeal to the Appeals Council, and finally, you have the option to seek review in the federal court system. It's a long, protracted process.
The numbers on that administrative burden are shocking, especially when we look at recent challenges.
The scale is immense. The ALJs, the judges, have a goal of resolving between 500 and 700 cases a year. Just think about that workload.
500 to 700 cases.
But due to staffing issues and, critically, the disruptions from the COVID-19 pandemic, the system faced enormous strains. In 2020, only 18% of ALJs actually met that annual case disposition target.
Which means long, long wait times for people who desperately need disability income. It underscores the human impact of that backlog.
Absolutely.
Shifting gears completely, let's talk about the Social Security number itself. We mentioned it was originally intended not to be a primary means of identification.
And yet today, it is undeniably the de facto national ID.
It's a classic case of mission creep.
Totally. The SSN was created purely to track worker earnings for retirement benefits. Its unintended transformation into a universal ID is largely because of the Internal Revenue Code, which requires the SSN for all federal tax purposes.
So parents immediately needed SSNs for their kids to claim them as dependents on tax returns.
And it snowballed from there. There were attempts to limit its use. The Privacy Act of 1974, for instance, was supposed to restrict SSN usage.
But it didn't really work.
No, the sources show that the exceptions basically swallowed the rule. The Privacy Act failed to stop its proliferation because so many exceptions were written in, allowing state and local governments to use the SSN for essential functions like taxes, driver's licenses, vehicle registration.
So now it's just impossible to function in modern society without giving out your SSN, despite the SSA's original intent.
Pretty much.
Let's look internationally. How does the SSA handle workers who split their careers between the U.S. and other countries?
That's where international coordination or totalization agreements come into play. These are bilateral agreements that are absolutely vital for workers who might have spent, say, 15 years in the U.S. and 20 years in Germany or Canada.
And what are the two main purposes of these agreements?
First, they eliminate dual Social Security taxation. Without an agreement, a worker could be legally required to pay FICA taxes to the U.S. and also pay into the foreign country's Social Security system on the exact same earnings.
That would be crippling.
Totalization eliminates that double taxation. And second, they make sure that workers actually receive a benefit.
How so?
They fill gaps in benefit protection. If you have, say, 35 quarters of U.S. coverage, you haven't met the 40QC requirement to be eligible. A totalization agreement allows the SSA to count the credits you earned in the foreign system toward your eligibility.
And if that makes you eligible, what happens then?
Then the U.S. benefit is prorated based only on the time you actually worked in the U.S.
And the SSA has these agreements with a lot of major economies: Italy, Germany, Canada, the UK, Japan.
Many others. But the sources highlight one crucial nuance. The agreement that was signed with Mexico back in 2004, which would impact a massive number of binational workers, is specifically noted as not yet in effect.
So if you're counting on combining your U.S. and Mexican work credits, that benefit coordination just hasn't been implemented yet.
Not yet. That's a big deal for a lot of people.
Okay, we've established the structure, the funding, the calculations. Now we have to confront the core contradictions and controversy surrounding Social Security. And we start with that central paradox we touched on earlier, the tension between its tax and its benefit structure.
The regressive tax versus progressive benefit problem. This is the defining contradiction of the whole system.
On the tax side, FICA is criticized as regressive for two main reasons.
First, high earners only pay FICA taxes up to that wage base, $168,600 in 2024. So all their income above that is untaxed.
Which means someone earning $1 million is paying FICA on a tiny percentage of their total income, while someone earning $50,000 pays FICA on 100% of their income.
Exactly. And second, the FICA tax only applies to earned wages. It doesn't touch unearned income, things like dividends, capital gains, rental income, which make up a huge portion of wealth for high earners.
And that combination makes the funding mechanism deeply regressive.
But then the system whipsaws and becomes fiercely progressive on the benefit side.
Because of the PIA bend points, the 90, 32, and 15%.
Right. Low-income earners have their working income replaced at a rate that's 3 or 4 times higher than high-income earners. The CBO calculation confirms it. The benefit-to-tax ratio for the bottom fifth of earners is nearly triple that of the top fifth.
So the system functions as a massive intentional redistribution machine.
Albeit one funded by a regressive tax.
Moving to the political critique, we have to address the comparison of Social Security to a Ponzi scheme. Elon Musk brought this up in March 2025, and it's a sentiment we hear a lot.
Critics argue that, like a Ponzi scheme, the system requires continuous contributions from new, younger workers to pay the current retirees. And since the ratio of workers to beneficiaries is shrinking because of demographics, they argue the system is fundamentally unsustainable.
Structurally, though, the sources draw a very sharp line between Social Security and an actual illegal Ponzi scheme. What's the real difference?
A true Ponzi scheme is fraudulent because it hides the fact that there's no underlying asset or return-generating mechanism other than cash from new investors. Social Security is totally transparent. It's underwritten by mandatory tax revenue and by the interest-bearing treasury bonds in the trust funds.
And participation is mandatory. The rules are public.
It's not an illegal fraud designed to trick investors. No. The financial historian Robert E. Wright, he tried to bridge this gap by calling it a quasi-pyramid scheme.
A quasi-pyramid scheme.
It's a term that acknowledges the similar sustainability challenges that are driven by population dynamics, new people funding old payouts, without equating the program to a clandestine, illegal fraud.
What stands out in the sources is the massive variability in outcomes for individual workers. It makes the whole system feel almost arbitrary. The Urban Institute calculator data really brought this to life, showing how an individual's net lifetime benefits can swing so wildly.
That data is stunning. Just look at a single man earning $95,000 a year and retiring in 2045. Because his taxes are capped, but his benefits are also capped, he's estimated to lose over $200,000 in net benefits over his lifetime.
He pays far more into the system than he or his estate will ever get back.
Far more. Now contrast that with someone earning a very low wage, say $5,000. That person still gets a positive net benefit because the progressive formula gives them back 90% of their income, even though their tax contributions were minimal.
And gender plays a role here too, just based on life expectancy.
It's an unavoidable factor. Women generally receive a higher net benefit, and it's just down to simple longevity. The benefit calculations are based on actuarial tables that average men and women, but women generally live about 3 years longer.
So they collect benefits for longer, leading to a higher positive net return.
But the single biggest individual swing factor, according to the Urban Institute's data, is marital status, which seems completely counterintuitive for a system that's based on your covered earnings.
How big of a swing are we talking about?
Hundreds of thousands of dollars. Take that same high earner, the one who was projected to lose $152,000 if he stays single. If he marries a stay-at-home spouse who has little or no career history of her own, and she collects a derivative spousal benefit, 50% of his PIA, that household could become a big winner.
And what's a big winner?
Receiving net benefits of around $165,000.
So the difference between those two scenarios, the single high earner versus the high earner with a non-working spouse, is a swing of over $300,000 in net lifetime benefits.
All based on the marriage decision and the reliance on spousal benefit.
It reveals a massive blind spot in the system.
It does. The progressive benefit formula is entirely blind to non-wage income. If a high net worth individual structured their finances to show a low wage history, maybe they got their income from dividends or rental income instead of a salary, they still appear poor based on covered earnings.
And they'd qualify for the higher 90% replacement rate.
Potentially collecting high net benefits despite being very wealthy.
Let's move to the COLA debate, the Cost of Living Adjustment Index. This indexing affects the purchasing power of every single benefit check.
Currently, the COLA uses the Consumer Price Index for urban wage earners and clerical workers, or CPIW. And the core argument is whether this index accurately measures the inflation that's actually experienced by the massive population of seniors who rely on it.
On one side, some economists argue that CPIW overestimates inflation.
They say it doesn't account for substitution effects. When the price of beef goes up, you buy more chicken. They suggest replacing it with the chain CPI or CCPIU.
And the chain CPI generally results in lower annual adjustments.
It does. So if the government adopted it, it would lower future payouts, and that would reduce the 75-year actuarial deficit. It's basically solving part of the solvency problem through inflation indexing.
But the counter-argument is fierce, especially from advocates for the elderly. They argue that CPIW actually underestimates inflation for seniors.
And that argument centers on consumption patterns. Seniors spend significantly more on medical care and housing, and medical costs in particular rise much faster than general inflation.
So they suggest using a dedicated CPI for the elderly, CPIE.
Right. And researchers estimated back in 2003 that if CPIE were used, the trust fund would run out of money 5 years sooner than projected. It's a clear illustration of the massive financial difference these index choices make.
Finally, we have to talk about the truly bizarre administrative controversy that's noted in the sources. The non-death date issue. This sounds like something out of a science fiction novel.
It's a huge data integrity issue inside the SSA. An audit report from the Inspector General in 2023 noted that the SSA's main database, the Nubitant, includes approximately 18.9 million records for people born in 1920 or earlier, so everyone is over 100 years old, who have no death date recorded.
Wait, 18.9 million digital ghosts who should all be centenarians or super centenarians. That sounds like a catastrophic failure of data management at a massive fraud risk.
That was the immediate concern of the OIG, the Inspector General. They recommended that the SSA correct these records to prevent improper payments across all kinds of government systems that rely on that database.
So did the SSA fix the records?
They declined. They cited the high cost. Their estimate to fix it was between $5.5 and $9.7 million, and they argued that correcting records for people who aren't getting benefits would divert resources from those who are.
So what was their solution for the fraud risk?
They argued the risk was low because back in 2015, the SSA implemented an automatic system where entitlement to benefits is terminated for anyone who's listed as being 115 years or older.
So those 18.9 million individuals are largely just old digital ghosts in the system, but the SSA has accounted for the payments risk by just assuming anyone over 115 must be deceased, even if there's no death date on file.
Precisely. It's an administrative workaround that prioritizes cost over absolute data accuracy, which just speaks volumes about the constant battle the SSA wages against its own massive administrative scale.
This deep dive into U.S. Social Security, it reveals this complex ecosystem that's defined by these profound tensions. We've seen, I think, three critical areas of friction that are going to define the system's future.
First, that fundamental tension between the regressive nature of the payroll tax, which disproportionately burdens low and middle earners, and the highly progressive structure of the benefit payouts, which ensures a stronger safety net for the least affluent.
Second, the urgency of the solvency battle. The projected depletion of the trust funds in 2035 means Congress has, what, a decade at best to enact significant, painful changes.
Whether that's raising the taxable wage cap, increasing the overall tax rate, or adjusting benefits and the retirement age, a 23% benefit cut is the consequence of doing nothing.
And third, just the staggering complexity of the personal claiming decisions. The timing of your retirement claiming early at 62 versus waiting until 70, that can result in a 54% swing in your monthly benefit.
And as that Urban Institute data showed, even your marital status can lead to a swing of over $300,000 in your net lifetime benefits. It's just wild.
This brings us to a final provocative thought. Despite all these challenges, why is Social Security so fundamentally indispensable to the American financial structure? And the sources point to a massive ongoing crisis in private retirement savings.
The statistics are sobering. In 2010, the median retirement account balance, so your 401k or your IRA for workers age 55 to 64, was only $120,000.
$120,000. That amount, when you spread it across a 20 or 30-year retirement, provides only a trivial supplement to Social Security.
And the situation is often just dire. 75% of Americans who were nearing retirement had less than $30,000 saved in their retirement accounts.
Less than $30,000.
This is why Social Security remains a central safety net. Its ability to pay 77% of scheduled benefits, even if the trust funds are depleted, is absolutely essential because the vast majority of workers simply have not accumulated adequate private savings. It's a public guarantee filling a massive private sector failure.
Given all this detailed information we've gone through on the PIA, delayed retirement credits, the FRA, the claiming dilemma, we strongly encourage you to take the next step. Use your official My Social Security online account and the SSA's benefits calculators to explore your own what-if scenarios.
Only by understanding these complex variables can you truly construct your financial future.
The rules are arcane, but the implications are immense. Thank you for diving so deep into the mechanics of this vital, complex system with us today.
Until next time.